Welcome to Black Health Matters. I'm your host, Daryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Articles in Washington Post on Monday. One of them was the unexpected symptoms of a heart attack. As many of us are over 50, we're likely to have heart problems. And so they identify about five issues that uh, may be unexpected symptoms of a heart attack. And the first one they mention is jaw pain. That we know about the chest pain, but sometimes jaw pain can be one of the manifestations of a heart attack. So that uh, location of the pain isn't always in the chest. So jaw pain is something to concern about. Nausea and vomiting can sometimes uh, be mistaken along with indigestion as a sign of a heart attack, although uh, in school they always taught us that indigestion is a heart attack until proven otherwise. Uh, but anyway, nausea and vomiting, belching, and other things can be a sign of a heart attack. And then a sense of impending doom, the fact that you think you're gonna die, you get that sense that you're gonna drop dead, could be a sign of that you're going to have a heart attack. And then sweaty, cold, and clammy skin is a sign that you're in shock and will often accompany a heart attack. So if you get sweaty, cold, and clammy, all of a sudden that's one of the, especially if it's associated with any kind of chest pain in the front or the back. And then finally, they list uh, fatigue, where you suddenly don't have any energy. And of course, other signs are when you get pain when you walk and it goes away, whether it's chest pain or back pain or anything like that, may suggest that you have a blockage in the coronary arteries. So that those are some of the things that you might have, which is a little different from the garden variety chest pain that you might have when you have a heart attack. Of course, uh, chest pain in the middle of the chest or in the back, still signs of heart trouble and likely of a coronary artery disease and a heart attack. Um, Another article that, any comments or questions about those uh, uncommon manifestations of heart disease and a heart attack?
I had a question. With the um, with the I was just wondering what would be the connection between the other pains to the heart.
All of any pain that's around the jaw or the chest can be related to the uh, heart because the pain fibers of the heart uh, uh, can be manifest anywhere along that area between the jaw and the chest.
So I was thinking more of the digestive symptoms.
That's because the heart is right in the middle of the chest, and so the indigestion or the
Mhm.
uh, uh, can really just be a manifestation of the heart disease itself, and that's why whenever somebody has indigestion, we consider it uh, heart disease until we can prove it otherwise by other tests. So this is the location of the heart in proximity to same area of the stomach and the esophagus, which is right there.
I see. Thank you.
The if there are no other comments, the second article is something that is really kind of vital for people who are under our age, people who are 65 and older don't really have a problem with getting coronavirus shots because they're approved for people who are over age, over 65 and who have high risk issues. But people who are under 65 with this new CDC and new RFK Kennedy administration, there's a lot of confusion. And so as a consequence, they had 5 questions that they asked. For example, uh, why have they limited the vaccines to those people who are over 65 and high risk Americans? And there is really not a lot of evidence that they should have done that, but they have done it nonetheless. And so it makes it very confusing, uh, particularly in the District of Columbia outside. In Maryland, the pharmacies are ready to give you the coronavirus vaccine and the flu vaccine. But in the District of Columbia and some other areas, uh, if you're not over 65 and you're not high risk, uh, you may have to document that you're high risk in order to get it. Because if you're under 50 and you're not high risk, uh, then they're not so authorized to give it to you. Uh, uh, and I think that's one of the first issues. How do I prove to anybody that I need to get a shot for the coronavirus since Kennedy has restricted it so much?
Hmm.
Uh, and how will I be able to get protected if I have pre-existing conditions, even though I'm under 50? And the answer is you have to prove it, and that's kind of tough. Of course, if you go to a pharmacy and they already know you're a patient there and you already have conditions, then that's not going to be so hard. But if you're under 65 and you have no high risk, then getting uh, coronavirus vaccine is going to be harder than it ever was before.
Hmm.
The next question is why did they make the changes? And that's a good question. I don't think anybody give a good answer to that. And then the question, when will the updated virus be available? And, well, it's actually approved by FDA and is available now. But getting it from some of your doctor to give you a prescription for it, or the pharmacies in DC may be an issue. What about kids uh, who are healthy? Of course, now with this RFK version of it, if they're healthy, there doesn't seem to be an interest in giving them the coronavirus if they're healthy and young. Uh, Then it's the last question. I'm going to the United Kingdom, and should I get an updated virus if I'm traveling? And the answer is yes, because you're best protected if you have a virus. And the recommendation for the coronavirus is that you should get a vaccine every 6 months uh, to be on the safe side. So those are some of the questions, some of the issues that those who are under 65 have to deal with in getting the coronavirus. Those of us who are over 65 or who have high risk conditions should have no problem getting the coronavirus vaccine. And again, it should be every 6 months or thereabouts. Any comments or questions about that? Because it's one of the commonest topics that is addressed these days with the new administration, health administration. No comments, no questions. In that case, let's go into the articles. This is a article on topic that we don't discuss too much about skin conditions. We know that the skin is the largest organ in the body and protects us from so many issues. And so because of that, it's something that should be very important and something that we should be knowledgeable about, even though we don't we don't have a whole lot of articles on skin, but it's important. Uh, and changes in our skin can identify that there are conditions that need to be dealt with. And so we've looked at many of the things, whether you have a dry, itchy scale or cracked skin. If you have to scratch a lot, that's a sign of skin condition that whether it's eczema or psoriasis is a condition that may require over-the-counter lotions or different treatments, including steroids. Um, with us people of color, it's sometimes it's harder to identify some of these skin changes. But when you notice that there are rough patches in the skin or persistent bruising or itching, and of course, as you get older, you get more and more velvety dark patches called acanthosis nigricans, and these occur all over your body. And uh, though 90% of the time they're insignificant, they can be a warning of early warning sign of diabetes, or it can be nothing. While we recognize that melanin protects us from skin damage, we still get skin cancer, and we get malignant melanoma and other skin cancers, squamous cell cancers, that have to be removed, or else they will become cancers and they can spread and actually kill you. So that it's important, therefore, to protect your skin with ultraviolet sunscreens that can prevent you from getting skin cancer. Uh, and it's suggested that you wear caps and glasses to protect that protect you from ultraviolet light that will give you cataracts as well. So that the sun is wonderful, but it can be very damaging to the eyes as well as to the skin. And as you go down the line, you'll see that knowing that if there's any change in the mole, the bump, if it gets darker or if it starts itching or it becomes a sore, these are all warning signs that that skin cancer may well be the culprit. And so that's why you need to go to your dermatologist. And if there's any question, they can get a biopsy and find out whether it is a uh, cancer or not. Okay, I think that probably few of us get to see a dermatologist, but it's something that whenever you see any changes in a mole, bump, or spot, or new mole, or new growth, or patches that become darker, or sores that don't heal, or if you have something in the nail bed, these are signs that you need to pay attention to and get your physician to look at it. Mr. Buchanan?
Not a doctor yet. Thank you, though. I had seen my dermatologist several times. I had like eczema on my legs, around my calf, and in front of my lower leg, very itchy. And he recommended CeraVe, and I started using that. And after I shower, he said, put it on while your skin is still wet. And now I don't have that issue anymore. But if I don't use it, the the scratchy, itchy patches will come back. So I just use it every time I shower.
Thank you for sharing. Thank you. Any other comments about the skin and the incredible organ that it is in protecting us from so many problems? But
John, is that the CeraVe soap?
Sarah,
Say it again, Daryl.
Yeah, is that the CeraVe soap that you're using?
No, no, no. It's the lotion.
Oh, the lotion. Okay.
Yes.
Yeah, I use the CeraVe soap. That was a recommendation from Carol Tatum as a great moisturizing soap.
Oh,
thank you for sharing that. Okay. Any other comments?
let's see. People think that black people don't get sunburn.
Yeah.
We can get sun. I've been sunburned before, so be careful when you are in the sun, and fishermen and swimmers and people who are out on the water uh, can get a high chance of getting sunburn because the sunlight is reflected off of the water. You get the direct sun plus the reflected sun, so have to be careful. And when you use sunscreen, make sure it's reef safe so it doesn't kill the coral. Thanks.
Any other comments or questions? If not, we can go to the
Put
next.
those lotions in the chat, the names of those lotions that you all use. Could you put them in the chat?
Will do.
This article about why are more older people dying after falls. We already know that it's the number one killer for old people. But the data that they show in this article is that more than 41,000 Americans over 65 died from falls. And this was has tripled over the past 30 years. And of course, this one of the reasons because we have more, more people, but we have more older people. So that particularly over the age of 80, 85. So that when you're young and you have falls, it's not so dangerous. But when you get over 65, falling is associated with many complications which lead to death. And one of the most important things to do is to avoid falling where possible. And that's why exercise and is important to keep the muscles strong, and also getting bone density tests to make sure that your bones are not soft, and which makes you more likely, if you fall, to get a fracture, which has been associated with increased morbidity and mortality. So that fall prevention guidelines have been in place, but an ounce of prevention is worth a pound of cure, and preventing a fall is where most of the attention is directed. And that means that you uh, have your house safety protected so that it's very difficult for you to find obstacles in the way of your walking so that you don't fall. Any comments about this very important article to alert us to doing those things that will keep us from falling?
Yeah, my comment is that some chronic diseases can cause balance and dizziness issues, which can contribute to some falls. Um, and some things that come to mind are like hypertension. If you're taking amlodipine, that can cause some dizziness, particularly when you first get up in the morning. You may be unsteady on your feet, get some lightheadedness, and then fall. So if you find that issue with amlodipine, you may want to switch to another hypertension medicine.
Any other comments? Thanks for sharing. Yeah. Okay, I think there are a number of medications that have side effects, as Daryl has mentioned. And if you have any of those, it's important to let your doctor know so you can be placed on medications that don't cause you to fall or have your blood pressure to drop or anything like that. That's, oh,
I had that Dr. Callender. I had I forget the one that I had, but I would get out of the car. One time I almost fell out in the in the middle of the street uh, because I would get dizzy when I stood up. So I told my doctor, and he lowered it from 50 to 25 um, milligrams and put me on a different one as well. And I haven't had dizziness since then. Very important. Thanks.
thank you
And
for
Dr.
sharing.
Callender, I've had a couple of falls, and they were related to a virus that had affected my inner ear. And I've had to go to balancing sessions and a lot of therapy to get my strength back. But one of the things that I have been reading up on is reverse walking, which is supposed to be good for your balancing. And I've been doing that recently. And I do feel myself getting much stronger, along with going to the gym.
Thank you for sharing. Thank you for sharing. Any other comments?
Yoga also helps with balance.
Okay. All right. If no more comments, let's go to the next article. Yeah, this is interesting in spite of all that's going on, cutting things. The House Republicans proposed a 6% budget cut, Health and Human Services, for next year. It's not that it's bad enough as it is, but it's going to be worse. So it's not good news, but it's news. Uh, and I think that what's important is that we do as much as we can to protest these things and try to stop some of this activity. There was a meeting by Bernie Sanders and his group who are calling for the resignation of Kennedy as being Health and Human Services Secretary. Uh, I'm not sure that's enough, but anyway, it's a step because it's something the Republican administration is pushing for. But it's time that we take strong positions against all these cuts that are aimed at reducing the American budget, but yet at the expense of the people at the bottom of the poll, and the people at the top are getting richer and richer, and the poor are getting poorer. So this is something that bothers us, and it's something that we need to be outspoken about. So the more we uh, let congressmen and congresswomen know that we don't want this to happen, the better off we are. Barry Sanders had an important meeting to that end this week, so uh, we need more of it, more things like that. Any other comments or questions?
Yeah, the cuts are likely to affect grant programs, which I think could be research and administrative functions, meaning staffing cuts. And HHS has a budget of about $1.8 trillion. So that's one of the largest budgets in government. And if you cut it, it could fund some things like tax cut to billionaires.
Okay, any other sharing? Thank you for sharing, Daryl. Any other comments? I think the comment that Daryl made some time ago is that we have to be vocal in our opposition to these things because that can make a difference. Let's go to the next one. This is an article that uh, Florida has moved to end all mandates for school vaccines. They're the first in the nation to do so, which is going to be kind of tough for Floridians and their children because they already have people who don't want to get their kids vaccinated anyway. But now that the mandate is there, is law gone, that's going to be interesting to see what impact that has on the rest of the children. So anyway, this is the one of the first states to do so. Be interesting to see who follows Florida. Florida, which is anti-DEA anyway, and has been so for some time. It's not surprising to be the first state to do that.
This puts teachers at risk. Kids coming in without any vaccines. I mean, it used to be mandatory before you could even walk in the school door. You had to have all these vaccines. Um, Without them, I'd really be afraid for the teachers.
Any other comments? If not, we're in an era in which everything that science has demonstrated to be of merit is being tossed out the window.
Considering the back to the vaccines, the fact that they are no longer mandated is one thing, but that does not stop the parent from having the children vaccinated. Am I correct there or not?
You're correct.
Okay. So it seems as though the school systems or teachers or those who were interested in their own safety would see if they could get some type of indication as to whether or not the kids had been vaccinated. And if they have that record, they would know which ones, I don't know if it would do them any good or not, but they would know how many kids had been vaccinated on their own.
Well, fortunately, it's only in Florida. So the question is when it spreads, how is that going to impact the rest of the students as well as the teachers?
Yeah, I think without a mandate, you have no way of knowing which students are vaccinated.
Yeah. And which makes it very dangerous. So
I want to welcome Aurelia Clifford because she's very special, very, very special woman. I think
That's
this is
just because I was a friend of your mother.
absolutely, and mine, and also a student of mine in computer
Yes,
class at
that's
Spencer.
right.
That's why she knows all this technology stuff.
Yes,
well,
good morning, everyone. Good morning, Dr. Callender. Yes, Miss Clifford is a part of Washington Senior Wellness Center with all her attributes. And Miss Sue is online too, as well as members are in the multipurpose room. So we're
Good,
glad all of us are here today.
good
okay.
morning, everybody.
Hi, welcome.
Morning, Miss Sue.
Welcome. Welcome. This is an article that shows that Kennedy, he has a good concern about everything being linked to autism. And of course, the data is unclear on that. But the report is not shared yet, but he's suggesting that Tylenol shouldn't be used in pregnant people because there's a suggestion that it's related to autism. Well, of course, the data hasn't yet surfaced, so we await that report. Anytime you say could be a potential cause of autism, it means that you don't have the data to support it. So,
Yeah, I like what you said that Kennedy wants to relate everything to autism, including vaccines. On right-wing social media or people that are on social media, and then they subscribe to some right-wing feeds, and they're just they're drowning in that misinformation. They like to say that vaccines cause autism, and so a lot of parents take that as gospel and won't get their kids vaccinated because they don't want their kids to have to have autism. You know, they'd much rather that that their kids have measles, rubella, polio.
yeah, well, it's the tragedy is that social media is a source of disinformation and misinformation, and doesn't require any proofs. So people say whatever they want to say without data to support it, and that's one of the biggest uh, errors of our time is having social media as a fact or misfact uh, area because people hear and see what they hear on social media, and some of them think it's true. And then, of course, you have uh, other factors in our administration where we have uh, misinformation as truth and truth as misinformation. So these are the enemies of truth. And there used to be a time when we wanted truth. And now we are unclear as to what is the lie and what is the truth. And the place where all that happens most is on social media. So it's very
one of
dangerous arena.
Yeah, one of the interesting things about social media is that a lot of the misinformation is generated by Russian, Chinese, North Korean troll farms where they put out the misinformation, but in their own countries, they restrict social media and they mandate vaccines. So the idea is to destroy America from within.
Yeah, that's where destruction comes from.
Hmm.
Any other comments?
Yeah, I was going to say that Kennedy has a personal vendetta in this arena because I think I heard, and I don't know if this is social media or not, but he had a child or a relative that had autism, so it's in his family. So, and he wants to cut everything else, but anything that's dealing with what had affected his children or his relatives, he's going to put all the money behind that. Autism, everything's autism. And I hadn't really heard that much about autism before this. I know I've had students that had it, but it wasn't as prominent as many other uh, issues that we have to deal with. So that's just my take. Thanks.
Any other comments? If not, let's go to the next article. It's an article that John Buchanan pointed out that RFK has promised to make our children healthy again, and this is an article that you should read. It points out how he plans to do it. Um, Looking at the article, uh, it's not clear to me how he plans to do it, although I agree with his concerns about pesticides and microplastics, which is a very important issue, as well as the ultra-processed foods. All of these things are issues. However, how he plans to do it and what he's actually doing uh, seem to be counterproductive to moving forward. And if he would focus on the things that he talks about in this article and not have in place the things that he's already done, then it would be a different story. But in point of fact, uh, he's not so much focusing on this as he's focusing on cutting out things that have already been demonstrated to be beneficial, like vaccines. Any other comments about this very good article that concludes by indicating that yes, if he would stick to the things that he knows what he's talking about, then we would be well off. But he's uh, working in areas that he's relatively ignorant on, and his ignorance is manifest because he is not recognizing that vaccines work, and vaccines have saved millions of lives and continue to save millions of lives, and us going backwards and doing away with them is just the opposite of what should be happening. All the other things that he's talking about make sense, but he should stick to what he knows, not what he doesn't know. Because much of his strength is in the areas that he talks about, which is the ultra processed, the microplastics, and all those other things. And I think that's very important. But he's also contributing to the elimination of things that are scientifically proven and that work, which is the biggest problem with Kennedy. Any comments? Because I think the conclusion of this article is what is the problem. Well, I hope you all take a opportunity to read it and recognize the inconsistencies. Think of all the things his assault on vaccinations is likely to be his undoing. No comments? If not, let's go to the next article then. It's an interesting article about chronic obstructive pulmonary disease. Our patients, what they eat, and they talk about the fact that the Mediterranean diet and a diet which emphasizes vitamins and fruits, vegetables, unprocessed meats, and healthy fats uh, plays a major role in all morbidities, especially COPD. Uh, Although it's clear that once you have COPD, uh, it's not going to cure COPD, but it's going to help you when you add all the other things, exercise and a plant-based diet, which will help you endure COPD and become stronger and help your lungs to thrive uh, rather than actually kill you. COPD is something that obstructive lung disease is something that requires people to be on oxygen and is a source of chronic illness and death. Uh, and being short of breath is something that most of us are unaware of and don't realize how we take for granted that we breathe and are not short of breath. And any comments about this article on COPD and its relationship to what we eat?
Yeah, my comment would be that dairy consumption is some research suggests that it has an effect on COPD because it can increase mucus production.
Okay. All right. Any other comments on pulmonary diseases and chronic COPD, which is something that many fear? And smokers are among the people who are, and asthmatics are the people who suffer the most from it. Okay. Uh, this is an article that says not only is stopping smoking important for you, but also if you're also a substance abuser, stopping smoking may help you stop your substance abuse. And they found this connection. Uh, so they are suggesting that we keep that in mind and try to get more people who are substance abusers to stop smoking with the expectation that that will help. This is an interesting finding that I think is important to share. It's interesting that smoking has caught on so much over in Europe when we've made it almost illegal. But in Europe, you see so many people smoking. Any comments on smoking cessation and substance abuse?
Yeah, I think that cigarette smoking and cigar smoking, pipe smoking, those are to me gateway drugs. You know that nicotine is highly addictive, and you know it when you take your first hit off of a cigarette, it lowers your blood pressure, so you feel cool. That's where that name came from. So, and then you add the menthol to it. It's got a cooling effect. And but after about 20 minutes, after you take that first hit off of a cigarette, your blood pressure goes up higher than it was when you started. So then you have to get another cigarette to lower it, and it's a cycle that keeps going. And before you know it, you're addicted to cigarettes. And then somebody says, "Well, try this," and then you'll try something else that's even more addictive. And this article is like focusing on people who are addicted to other chemicals, heroin, and so forth. Um, Cigarette smoking can lead you right back to that because of that cycle of chasing that first high that you get from it. Thanks.
Thank you for sharing. Any other comments?
Yeah, my comment would be that multiple addictions can be codependent and intertwined with each other and can fuel each other in a harmful cycle. So that's why you see so many people that smoke and drink or drink when they do harmful substances like cocaine, crack, heroin, whatever. Um, like when you drink, you want to smoke. When you smoke, you want to drink. Or, they get just all intertwined with each other.
Thank you for sharing. Any other comments? If not, let's go to the next article. Please. This is interesting. FDA approves this multimodal cardio tag monitor. We had mentioned earlier that these wearable sensors designed for cardiovascular monitoring allow the wearer's heart and pulse rate to be looked at and also to speak to the wearer as to whether or not they have abnormalities that require going to the hospital. The only issue that is not addressed here is the expense of it. And uh, while FDA clears it, it does not clarify how much it costs or who's going to be able to purchase it because, as we mentioned before, uh, often people who purchase these things are people who are the higher income people, and the people who are lower incomes don't get the benefit of it. And so it's a concern, an issue of health disparity in which the is widening rather than narrowing of the majority minority health disparity, especially if the warning sign can get you to go to the hospital and keep you from dying, and those who don't have it die because arrhythmia is the commonest cause of sudden death anyway. So it's meaningful to be aware of these things, but it's also important to appreciate the uh, what the cost is, and these articles don't address that. Any comments, additional comments about this, which I think are going in the right direction. It's just the fact that they may not be available to people in lower income, but rather to people in higher income. And it's true, they may meet patients where they are if their patients have the money to take care of it. There are no comments. We go to the next article, which says something that we've been talking about forever, I seems. Except we seem to be changing our targets for blood pressure control on an annual basis. We're now at wanting to have blood pressures below 130 over 80. We've left 140 over 90 down to 130 over 80, although there are some articles that still prefer 120 over 80. But this article is saying that uh, if you're not 130 over 80, you should promptly begin antihypertensive meds. There are those who feel that the first thing you should try is exercise and diet, 3 to 6 months. And this article is saying, no, start right away. Any comments? They emphasize again, plant-based diets, which the DASH diet and other diets like that, which make a difference. I'm happy to see finally that they're talking about urine protein studies because that's the earliest manifestation of kidney disease is urine albumin, urine protein, and the emphasis on reducing the sodium intake. Saying capping it at 1,500 milligrams per day, which is even lower than the 2 grams that they used to have. And this article also talks about losing weight and how that helps. Although some of the worst blood pressures I've ever seen are people who are skinny. But anyway. We've had this comment about the alcoholic beverages. So, and I think Down made comments about that last week. Any questions, comments?
John,
Dr. Callender, what is too low of blood pressure?
Less than 90.
Less than 90, okay.
John Taylor has his hand raised.
Yeah. Good morning and good afternoon, everybody. I had a question about blood pressure. There's no perfect blood pressure for an individual. Dr. Callen, I want to ask you, can you say a blood pressure for a person is their perfect blood pressure?
No, something's going on with the sound. But I think that the guidelines that they've set are pretty good. So if you keep your blood pressure below 130/80, I think that's good. Ideally, one less than 120/80 is also good. But no, I wouldn't. I would just stick to that as being the best guidelines. Any other comments or questions?
Let's in dealing with blood pressure, since your systolic pressure is subject to change for throughout the day for minor things that are going on in your life, should one pay more attention to the diastolic pressure, which remains more or less fairly constant throughout the day?
I think they're both important. I think you don't want to have the systolic higher than 130, and I don't think, and I agree with you that the diastolic is less likely to be variable, but the variations on the systolic are very important as well. Because the higher it is, the more damage it can produce. So I think they're both important. But I would admit that there's a greater variation on the systolic. But then that variation could be very high, and that could be very damaging and cause complications of stroke and other kinds of changes. So my answer is that I think they're both important, and you want to keep the systolic and the diastolic under control. Any other comments?
Janice has her hand raised.
Yes, yesterday I had my physical and my blood pressure was 130/60. Is that considered low? Is that
That's fine.
good? Good. Okay.
Any other comments? I can't see the people who raise their hands for questions, so speak out. Okay, let's go to the next article then. This is interesting. Beetroot juices. Uh, beets have been demonstrated as one of the best uh, vegetables that you can have. And the benefit is because of the nitrate richness of the beets. There have been a number of studies that have looked at the vegetables that are the best of all, and the beetroot juice is high up among them, and some think it's number one, number two, or whatever. But the benefit is that the nitrate helps lower the blood pressure. So that's why beets are so good for you, and beetroot juice is especially good. I'm not sure there are a lot of people who love beets, but those who do are have got something special.
Yeah, my comment is that I do that every morning. I get up and I take a fruit juice glass of beet juice, which is probably about like 6 ounces.
Wow.
And I take it on an empty stomach as soon as I get up in the morning, and it is effective. Um, and then, I eat breakfast about an hour later. Um, and I do that. John Buchanan will love this. I do this in spite of beets being a man made hybrid vegetable.
Yeah. That is hard to believe.
Well, I make exceptions when something works.
So my question is, why wouldn't you eat the beets instead of just the juice?
Yeah, well, I'm doing it for convenience. The beet is even better.
I figured as much. I
But
like
now
I
that I'm
like
in my 70s, I have some moments where I get lazier and I look for convenience.
Mhm. Yeah, I like beets. I've always liked beets, but I never heard about the beet juice. So you can buy the beet juice separate.
Yeah, it's best to buy it pure, unsweetened. There's some where you can get 10%. It's it's a little rough. It's a little strong taste. So you can add apple juice to it if you want to. Although I'm not a fan of juice because that removes all the fiber. But just you'll get used to it if you do it every day. It's got a strong taste, but you can get used to it.
Thanks for sharing.
And don't overdo it. Um, you'll find that you get some digestive issues if you take a tall glass of beet juice. That's too much. A little fruit glass is just the right spot.
The conclusion, you see these additional uh, vegetables that you can take that provide similar benefits, but it's tough to beat beetroot juice. Okay, let's go to the next article if there are no additional comments or questions. Now, this is something it's interesting because Daryl had made a comment about this. One of the things that I've noticed is that sometimes patients who have had the AFib ablation still are taking anticoagulants. And this is an article that suggests that they should stop the anticoagulants because they don't need it. The reason for the anticoagulation was if you had atrial fibrillation that persisted. And if it persisted, then you had a likelihood of stroke or other uh, complication like that, which could be avoided with a anticoagulant. But if you have ablation, there's no longer the need for the anticoagulant. And this article points out that those patients who had ablations and no longer had atrial fibrillation were better off without the anticoagulants.
Dr. Callender, what's ablation anyway?
That's a special treatment that they give to the heart that stops the heart from fibrillating. It's a special electronic. It's just like have a defibrillators for ventricular fibrillation. The difference is in ventricular fibrillation, the heart stops beating completely, whereas atrial fibrillation, the heart still beats. And so they block the what is causing the atrial fibrillation by electronic beams, and this then stops the heart from fibrillating, and the heart then starts bleeding normally. But if you get an EKG and you're fibrillating, the P waves do not, the atrial function is not what it was before. And so as a consequence, you're more likely to have blood clots. And this ablation, where they use beams to block the dysrhythmia, is something that they do for patients who are healthy enough to have it.
Yeah, I did the catheter cardiac ablation last December, and my cardiologist still has me on blood thinner, the anticoagulant. He has me on Eliquis, which
Right.
it's expensive. I think they're just still monitoring my AFib to make sure I've got normal sinus rhythm for maybe about a year, and then they can take me off the Eliquis. Um, so anyway, that's my hope. Eliquis doesn't have any side effects for me except for if I ever get a cut, I don't clot as quickly, and so I have to put pressure on it. It's just a hassle when you're a bleeder, and that's what you tend to be when you're on blood thinners. Um, but Eliquis is a lot easier than warfarin. Um, I forget what the trade name for warfarin is, but
Coumadin.
yeah, Coumadin. Uh, you've got to get periodic tests for warfarin. I don't know if it's like 60 or 90 days. You have to get retested. Whereas with Eliquis, you don't. Um, but drug prices are going up, and I get my Eliquis from a Canadian pharmacy, which now with the tariffs, the price has gone up $80 on each refill. And so I've got enough refills to get me through the end of the year, but I'm hoping that at the end of the year, they can take me off of Eliquis so I won't have to deal with the price of Eliquis.
Okay.
Dr.
Callender.
Yes.
I'm on warfarin. I've been on warfarin for maybe 5 years, and I have to get a test done every 2 or 3 weeks. I have to give blood every 2 or 3 weeks. It's not that far apart, as he suggested.
You said something about 2 weeks.
It's every 2 weeks, every 2 or every 3 weeks.
Yeah.
They test your blood because your number changed so much.
Right. That's why Eliquis is preferred by most people.
But Kaiser don't give you that.
What's that?
Kaiser permanent, they won't give you that.
They won't give
Oh.
you. They won't give you that. Your doctor won't prescribe, or is it just Kaiser? Or is it the pharmacy?
Kaiser.
The pharmacy.
Yeah.
My nephew have it.
Is he a Kaiser?
Yeah, he from Callender.
Check the pharmacy.
Okay.
Check the
Okay.
pharmacy and see if it's in their system.
Okay,
Yeah, because
And then online they have a list of drugs too.
okay.
but he's on Eloquent and he has Kaiser.
Okay, Dr. Calvin. Okay, thank you.
Right. Yeah. It's little question that Eliquis is preferred under most circumstances. There is one condition in which you can have antibodies against Eliquis, which is unusual, but that's the only condition in which warfarin would be preferable if you had antibodies to Eliquis. But this article, of course, is suggesting that if you no longer had the AFib, you wouldn't need to be on the Eliquis. But anyway, this is, I think Darrell talked about his position wanting to be sure that you were not fibrillating for a year before he stopped the Eliquis. So this would be up to the physician to make that decision.
So,
Okay.
Dr. Callender, whatever
Yes.
happened to the 81 milligram aspirin?
Well, you can't be on both. You got to be in one or the other.
So aspirin could work, and that's a lot cheaper than what you're talking about, right,
No,
Daryl?
but aspirin is not comparable to the anticoagulant effect of Coumadin or Eliquis. Eliquis is a frank. You shouldn't be on both of them because one of them is enough. But of the two, if you are fibrillating, you need to be on either warfarin or Eliquis.
Okay.
Okay, thank you for your comments and questions. Let's go to the next article. This is an article that just points out something that we know already, that declining heart health in older adults is associated with hypertension, stroke, heart disease, coronary artery disease, myocardial infarction or angina, and is helped by LE8 metrics, which means diet, physical activity, avoiding nicotine, sleeping for at least 8 hours a day, BMI, normal blood pressure, normal blood lipids, and normal blood sugar. These are the metrics that go along with keeping you healthy. And this is an article that says that emphasizing all of those LE8 issues that are identified here go along with longevity. And if you have any of those conditions, normalizing them will help you combat heart disease. You see where they emphasize here that keeping your blood pressure less than 120 over 80 is a key, as long as you don't become hypotensive and have pressures less than 90. Any comments about this article, which is emphasized once again the exercise and diet? Because most of these articles don't emphasize the importance of meditation, which Darrell has often commented on, which is an addition that should be included in all of these commentaries. Any comments or questions? If not, we can go to the next article. This is an article that says that the tattoos are more risky than we think sometimes, because the tattoo ink may contain carcinogens. And if the tattoos don't contain carcinogens, then they're probably okay. But you have to be sure that the ink that they have does not contain carcinogens. We're in an era now when so many people have tattoos. And so let your children and grandchildren know that some tattoos have carcinogens, and so you don't need to be tattooed all over the body. John Buchanan, you have a question, a comment?
Sorry, I just left a hand up. Sorry about that.
Oh, okay.
I will never get a tattoo. Sorry about that.
Well, your children, grandchildren, great grandchildren, may you see them with things in their noses and tattoos and
My son has a tattoo, or two, or three, or four.
yeah, yeah. Okay, all right.
Dr. Callender, after you get the tattoos, and if you get them taken off, I know it costs a lot of money, will you still have this problem, the carcinogens?
Well, I think if you took away the carcinogen, then you wouldn't have that problem, right?
So removing tattoos help? Or once it's on there and it's in your bloodstream and you never.
I don't, I haven't seen a study that really compares those who had their tattoos removed with those who continue to have the tattoos. So until we have that study, I wouldn't be able to give you an answer to that question.
Uh, yeah, we had an article earlier about tattoos, and it said that removing tattoos did not reduce the risk of getting lymphomas from tattoos. And of course, lymphomas could turn cancerous.
Lymphomas are actually cancers.
It's funny because I remember growing up, to see someone with a tattoo, I always thought they were a sailor. So I guess the pop-eyed mentality. So I'm with Buchanan. I will never get one. But nowadays, everybody has a tattoo. Men, women, young, old. I guess it's a
Well,
thing that I just can't get used to.
people aren't aware of the risks. They think that they're safe.
Hmm.
And so if you have children, just spread the word about
Yeah,
how unsafe they actually are. They could cause cancer, could cause lymphomas, leukemia. There's nothing good about having a tattoo.
right. And I know young kids, as soon as they turn teenage, Mom, can I get a tattoo? Why? Why? Good grief.
Yeah.
But once they have it on, you don't know they got it until they're on and they come in front of you and they may roll up their sleeves or you
Yeah.
see something on their hand.
Mhm.
So then from what I'm learning, it's too late then. I mean, you're just looking at it and I'm going, oh man. But then the rest of their body where they got it all covered up and everything. So
Mhm.
that's why I was asking, because I would give my life savings to help them get it off of their skins.
Mhm.
But it's the
Well, let them
style.
You
Yeah.
let them
see,
know when they're babies.
you see what this article says about tattoo removal can backfire.
Mm.
Let them know when they're babies that if they get a tattoo, they're kicked out of the family. They're going to be homeless.
Mhm.
Yeah, that's easy for you to say, but that don't work either.
They may not mind getting kicked out of the family.
When I donate blood, that's one of the screening questions. I cannot donate if I have a tattoo.
Interesting.
That's probably why the blood banks so short of blood because everyone has a tattoo, like they said. So if you can't donate after having a tattoo, that's cutting down the amount of people that can donate.
Appropriately, though.
Yeah, it's in style. We started off, John would quote the Bible about not putting any marks on your skin for the dead and quote it. That didn't take any effect whatsoever on our children because everybody got one and they can't wait to get one. They even had the fake ones for little children that you can wash off so they look good. And then it's really hard because their friends say, "Ooh, that looks good. Where did you get that?" And blah blah blah. And then they're in a whole new conversation. They just been elevated while you're the only one that's putting them down.
Hmm. Okay. Let's go to the next article. This is interesting because this is something that I have been talking about for quite a while, is that the PSA was stated by white doctors not to be a good test anymore because it caused too many unnecessary biopsies. And so black men who developed prostate cancer higher rates than white men and died twice the rate of white men stopped getting their PSAs. And as a consequence, the question is this why you have more far advanced prostate cancer in men? And so this article is suggesting that the reason we have more far advanced prostate cancer in black men is because they stopped getting PSAs. And that's something that I think that black men should get tested for, irrespective of what they used to say. And this article is just pointing out that, yes, this may well be a consequence of not getting PSAs. Any comment about that? Because this is something that we've been discussing among black men for the last 5 years, because about that time is when they came out with the statement that the PSA should not be tested anymore. But any comment? So get your black men to be sure to get PSA tests annually, probably.
Yeah, I noticed my doctor did not order it. I had to request it. I'm with Kaiser, so I make sure when I have my annual physical to request the PSA.
Good move. Any other comment, question?
I got a comment about something that's related but not really, and that's BHP, the benign prostatic hyperplasia, enlarged prostate. If you have that enlarged prostate, doesn't mean that you've got prostate cancer. It's kind of like apples and oranges. Um, but a lot of men over 60 suffer from enlarged prostate. Some of the symptoms are urgent urination, nocturia, where you get up several times a night, 2 or 3 times a night to pee. And so you don't get a decent uh, a decent night's sleep. Uh, Another symptoms, dribbling. You don't empty your bladder fully, and you can get drugs for that. But there's some things that you can do to manage that uh, without drugs, like some simple things like uh, not drinking anything for at least 3 hours before you go to bed, cutting down on salt intake, uh, sipping rather than big slugs of like a full glass of water. Sipping water through the day is a whole lot better than washing down a meal with a big glass of whatever liquid that you're drinking. And for women that suffer nocturia, these ways of managing it can be very helpful, because when you're getting a great night's sleep, you sleep 8 hours without getting up. It helps so many things. It helps blood pressure, helps you feel refreshed. You're not tired. Um, it can, if you're pre-diabetic or diabetic, getting that great night's sleep without nocturia when you're over 60 years old can just mean a world of difference in improved quality of life.
Thanks for sharing. And as you said, men over 60 are likely to have BPH, as they call it, or benign prostatic hypertrophy or hyperplasia. And his comments are very appropriate. And thanks for sharing.
I had a question for Ms. Dorch. Um, how many are at the Wellness Center? We have 17 online total.
Okay.
Okay, I was trying to unmute. A total of 15 if I didn't miscount some people.
Wow. So that
16.
that that makes our highest attendance ever. Thank you very much.
You're welcome.
Tell your friends.
We're ready for the next article, man. Haven't had any questions from your group, Elizabeth? Now, this is an article that says that ADHD drugs may often be prescribed too early to preschoolers. And they are suggesting that there ought to be a time period between the time the diagnosis is made and the time that treatment is implemented. They think behavioral therapies for 6 months first is recommended. Uh, there's a lot of discussion about this, but that's what they recommend, that before you start them on treatment. Any of you teachers have any thoughts or comments about this?
Yeah,
I think they made too many it was like the phrase ADHD. Every child that couldn't sit in their seat for 20 minutes, which there are a lot of adults, and they wanted to get up and move. They took out recess and everything. So they were labeling every kid with ADHD, then wanted to drug them up. Then they're lethargic. They can focus, yeah, because they're almost in a stupefied effect. But people have had this for years, and I I always was against giving the kids medication just to keep them quiet. I know we have overloaded classrooms, but you can't do anything with the children. You can't even make them write, I will be still or anything anymore. You have to talk nicely to them. So they're tying our hands. They want the kids to stay focused. Then they drug them up. It's just a never ending cycle. Um, I really don't agree with it, but if you got a class of 50 kids and they're all running all over the place, then you want them all drugged up.
Any other comments?
yeah, that Adderall and Ritalin are highly abusive. They're addictive, and they're drugs of abuse in adults. I know. So I mean, to get kids started on it at that preschool, are you kidding? What I think it's setting up addiction studies for the
The
rest.
only nice thing about it is that Hispanic and Black kids were less likely to get those prescriptions. So in a way, they were doing them a favor. Any other comments on this?
Yeah. Well, my comment would be that that's not our path to get the ADH medicines. Our path is to get, for black and brown, the path is to get put in special ed.
Any other comments? Thank you. It's food for thought, and this is a topic that is going to be studied and studied again and again. And I think that their conclusion is a good one. That instead of putting everybody on it, you should uh, give it a chance, especially for preschoolers. Next article, please. Oh yeah, this actually goes back to a comment that John Buchanan had asked about aspirin plus oral anticoagulants raises mortality and bleeding, and that's why you don't put them on both aspirin and anticoagulant. You put them on one or the other because the mortality risk and the risk of bleeding becomes greater. As you know, there are people who feel that aspirin uh, is dangerous anyway, particularly if you don't have already have morbidity, and so there's a lot of people who feel that aspirin is an anticoagulant and as such increase the risk of stroke. But if you have symptoms and you have morbidity, then some people feel that it's worth the risk. But 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 no one would recommend that you have both aspirin and an anticoagulant, and that is actually contraindicated. Any comments about that? Because it's good to appreciate the fact that aspirin is such an effective anticoagulant that adding it to the anticoagulant makes you more likely to have bleeding. Okay, if there's not any comments, it's good to share that information. So, okay. Next article. It's interesting. This will be the last article, I guess. But salt intake is linked to all kinds of problems, but MASLD is a metabolic dysfunction associated liver disease that in the past has been associated with cancer as well as irreversible liver disease. Now we know with the GLP drugs that the GLP drugs may halt the progression of MASLD. But what this article is pointing out is that salt increases it dramatically as well. And so that the comment that was made about the salt being reduced from 2.3 grams to 1.5 a day is something that would be helpful as well. Suggesting that basically you should not add salt to your food. If you have it, it might be used before you get the food, but we'll miss you, Daryl. But we're done anyway. So have a good dental appointment, as if there is such a thing.
Okay.
But anyway, so that salt is just not good for us, whether you have liver disease or not. So.